I made a video last year about conditions that will not be approved for Social Security disability, and it garnered a lot of interest. So I decided to make another video on 10 conditions that usually, not always, but usually won't be approved for Social Security disability, in hopes that this will help people who are applying for disability. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. And as I stated in my previous video, I'm simply explaining to you Social Security's rules. I don't make those rules. The Social Security Administration is a huge enterprise with an annual budget of over $1.7 trillion, not billion, trillion dollars. And amazingly enough, the president has yet to see fit to put me in charge of that organization. So here goes, 10 conditions that usually will not help a disability application. And the first is tinnitus. Tinnitus is a hallucination. It's when people hear a sound that isn't real, and it's usually caused by disease in the ears or the nerves that connect the ears to the brain. And I often see veterans confused about tinnitus and disability, because tinnitus is the #1 reason people get Veterans Administration disability. It's very important for a veteran's disability claim. However, it is not on Social Security's radar, and you cannot get disability based on tinnitus from Social Security. You can get disability if you're deaf, and if you're very hard of hearing, that may contribute to a disability claim. But tinnitus, again, is not on the radar. The next condition, #2, that's not on the radar, and I see people mention this a lot, is insomnia, poor sleep, or lack of sleep. That will not help in a disability claim. It's not on Social Security's radar. Now, the third condition may be approved for disability, and that's fatigue. And I need to explain how doctors see the difference between insomnia causing tiredness and fatigue. Think of tiredness as how you feel when you haven't had enough sleep. That doesn't count towards a disability claim. Think of fatigue as how you feel if you've exercised very hard. For example, if you ran a mile as fast as you could. That can definitely be approved for disability. One example is heart failure patients. In heart failure, the heart doesn't pump enough blood. If it's not severe, a person may feel pretty decent just sitting in a chair. But if they try to do anything strenuous, like, for example, climbing a flight of stairs, they may get too much fatigue to climb a flight of stairs without needing one or more than one rest. The two hallmark symptoms of heart failure are fatigue and shortness of breath on exertion. And this brings up another point. Doctors measure fatigue usually by whether someone can climb a flight of stairs, and if so, can they climb more than one, or how far can they walk without needing to stop to rest. And when I ask people about climbing stairs, they will often tell me, well, I have no stairs in my house. This is something you want to have the answer to if fatigue is part of your claim. I would go so far as to suggest it might be a good idea to go to a building that has several stories and see how you do on the stairs. The next condition that will not be approved for disability by itself is high blood pressure. High blood pressure usually causes no symptoms at all. The person feels nothing. And if there are no symptoms, that's not going to qualify for disability. Complications of high blood pressure can and often do qualify for disability. High blood pressure is the #1 cause of stroke, and stroke usually results in part of the body being paralyzed and or numb. And many people, not everyone, but many people with strokes will qualify for disability. But high blood pressure alone will not be approved. And if you're finding this video helpful, you might want to subscribe. I put out a video about once a week about various disability topics. And if there's a topic you'd like me to address, please put it in the comments to the video below. The 5th condition is like high blood pressure. It's diabetes. Having diabetes alone without complications will not qualify a person for disability. However, the complications of diabetes may very well qualify a person. Examples are neuropathy, nerve damage due to diabetes, or hardening of the arteries, heart attack, or angina. Many people aren't aware that the risk of heart attack increases with diabetes the same amount it increases if a person smokes 2 packs a day. But again, diabetes by itself won't qualify. The 6th condition is wounds that have healed well. And here I'm talking about traumatic wounds, such as wounds from assaults, cuts, gunshot wounds, and also surgical wounds, wounds that doctors make when they're doing an operation. If the wound has healed up well without complications, it's very unlikely to qualify a person for Social Security disability. And I want to talk just a moment about dog bites. Most dog bites heal up well, but an interesting thing that I've learned is everyone who was bitten by a police canine, a police dog, was bitten for no reason and was just minding their own business when the police decided to sick a dog on them. I've seen quite a few people bitten by police canines, and they all tell me that. Wounds may qualify a person for disability under 2 conditions. First, a non-healing wound, a wound that simply won't heal. And there are many reasons for wounds not healing. As an example, in the past year, I saw a woman who'd had a mastectomy, a breast removed for breast cancer, and then had radiation therapy to the surgical area to make sure all the cancer was killed. Well, radiation is a known factor in preventing wound healing. And unfortunately, this woman's surgical wound would not heal, and it was over a year since her operation. And that means she has to keep the area bandaged, dry, and cleaned. So non-healing wounds may qualify for disability. The second thing is if there are complications of the wound. I recently saw a patient who'd been shot. The gunshot wound went in the back and came out the abdomen, and they'd had a large surgical wound in their abdomen. And when it healed up, it resulted in a large, painful hernia in the wound. That's a complication, and that would help a person's disability claim. The seventh condition is related to that, and it's what doctors call orthopedic hardware. These are the rods, plates, screws, and artificial joints that orthopedic surgeons, bone and joint surgeons, often put in patients to help whatever problem they're operating for. Provided the hardware is functioning properly and there are no complications, that's very unlikely to be approved for disability. If the hardware isn't functioning well, for example, if it's come loose or a metal plate has broken, that might qualify. And if there are complications, that might qualify. One of the complications that orthopedic surgeons dread is infection in the area of an artificial joint, because that is extremely difficult and often impossible to cure. And in the past year, I saw a patient who'd had an artificial knee implanted, and unfortunately, it had gotten infected, and despite multiple subsequent surgeries, it was still infected and giving this person a lot of trouble. And that may qualify for disability. But simply having plates or screws in your body won't qualify. The eighth condition is gastroesophageal reflux disease, or GERD. This is when acid from your stomach comes up your esophagus, your swallowing tube, into the back of the throat or the mouth. This is another condition that by itself won't qualify for disability, but there are occasional complications, such as the acid getting into the lungs, that may qualify for disability. The ninth condition that usually, but not always, doesn't qualify is sleep apnea. This is where a person has periods where they stop breathing while asleep. And usually this is treated with a machine that the person wears when they're asleep to prevent them from stopping breathing, called a CPAP machine. Now, if there's simply sleep apnea without complications, that won't qualify. But some people with sleep apnea get severe daytime sleepiness, to the point where multiple times during the day they'll fall asleep without warning. I'm not talking about someone who lies down for a nap. I'm talking about someone who's sitting in a chair and they're talking to you 1 minute and the next minute they're asleep. I actually worked with an emergency department nurse who had this problem many years ago and kept falling asleep on the job and eventually lost her job because of that. And if there's that sort of daytime sleepiness, it may qualify for disability. The final condition that won't qualify is a so-called psychiatric condition, ADD or ADHD, stands for Attention Deficit Hyperactivity Disorder, which again is not on Social Security's radar, and in my opinion is way overdiagnosed these days. I think that less than 1 in 100 persons who I see that have been diagnosed with ADHD actually has it. I think it's a false diagnosis in boys for simply acting like boys, and it's a false diagnosis in adults who enjoy the effects of amphetamines. You're free to criticize me if you don't agree with that, but that's my personal opinion. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.